in the war against aging, many people are looking to get rid of those wrinkles and droopy skin. Well, surgery isn't your only option anymore. In fact, facelifts could actually become a thing of the past. Founder of the Few Institute right here in Chicago discovered a groundbreaking method, and he's here to tell us all about it. Please welcome back Dr. Julius Few. Good morning, doctor.
Thank you for having me.
Oh, I'm so glad to have you back. Now, this groundbreaking idea was just featured in the New York Times, right?
It was.
And it's all about stackable treatments.
It is. And so, Val, even though I'm a plastic surgeon, I have so many patients who come in who don't want to go under the knife. And so what we realized at the Few Institute is really the idea that if you combine minimally invasive technology and you put it in a certain order, you can actually get near-surgical results.
Near-surgical results. Like, how close are we talking?
Well, you know, I mean, this is a technique that is not designed for somebody who's at the very end of kind of the aging process.
Okay.
But at the same, so
I
mean, that's what
point.
you'd expect.
No, that's a
so
good point.
let me frame it the right way. But if you have someone who's coming in, and this is often the case, who, you know, I may have a man or a woman in their 50s or 60s who really they're trying to avoid going under the knife.
Sure.
Then we can kind of combine things, or so-called stack things.
Oh, well, let's talk about the stackable treatments, because there's three there, and we'll start off right first with the Silkpeel. What is that?
So Silkpeel, the easiest way to think about it is imagine the medical-grade power washer for your skin.
Okay.
That's really what this is. This is a way to infuse different agents to help brighten the skin, help make fine lines and wrinkles actually go away. And it's ideal as even a standalone as a facial, but what we found is you can actually apply this to kind of open the door to the skin. And that's really where the concept of stacking came in, so that then I can apply other techniques that are less invasive.
And then, so the next one, if you wanted to go further, would be the icon laser, where you lower a laser on top of the Silkpeel?
So in one setting, and this is probably the most important part of this stackable concept, is over the course of an hour and a half in our office, we're doing all these things. So we'll do the Silkpeel, and then we'll follow it with the icon laser, which takes it a step further. Because remember, with aging, there are three things that happens for everybody. Our skin gets wrinkled, we lose volume, and things start to sag.
Right.
So that's what we're doing. We're targeting all three of those things.
Right. Well, we might be able to take this to some other areas. I'm just saying. You talk about sagging and falling in volume. All right, I digress. Excuse me. And the last step is the Ulthera in the stackable treatment. What's that?
So Ulthera is the only FDA-approved non-surgical way to lift and tighten the face and the neck. So what we're doing is we can apply this technology. It's focused ultrasound, and really the key, the thing that everybody likes about stacking these approaches is there's really no downtime, because we follow up with a medical grade makeup that has antioxidants in it. So somebody actually walks out of our office looking actually very presentable. A couple days later, they're really ready to go.
Right, and you have a sample of some of that makeup with you, too.
So this is the particular makeup is by Glow Mineral. I've researched a lot of different makeup. This is really one of the only ones that has an antioxidant in it, and it's really safe for us to use. We use it in men and women. Men are the hardest ones to get to wear some makeup, but they even will try it.
Right, right.
And the funny thing is, every now and again, I'll have a man come back and say, you know what, Doc, can you slip me a little makeup? I got a big meeting. And I said, wait a minute, this is already, you're 3 months out from the procedure. But so it does. It really, it's high quality.
Right. Now let's talk about costs, because when you're talking about how much would a facelift cost versus the stackable treatment?
So, I mean, as you start to look at stackable, I mean, I think the thing that's real important to remember is people are doing this so they can avoid both recovery and surgery. So it's not cheap. I mean, to do this stackable approach, when you put it all together, it's probably $5,000 to $10,000.
Okay.
So it's that's not a cheap thing.
No.
But at the same time, it lasts a long time. For a facelift, when you're looking at time off work and anesthesia and everything else, you're probably talking twice that or more.
Oh, wow. Let's look at, I want to look at some before and after pictures of the stackable treatment. So let's start with the before, because I'm very intrigued by this. Now, this is the before. Whoa. And that's the after. Yeah, you can see how it's totally, you don't see anything under the chin.
No, it's a way to really target the entire face, to treat the texture of the skin, to treat color or mismatch in color.
Wow, now this one's pretty dramatic here.
And so again, this is a way to target multiple components of the aging process. It can be done in one setting, very effective. This is probably one of my most powerful ones. You're going to see, I believe we have a picture after this. This particular woman, actually, her after picture is more than 7 years after the before picture.
Oh, really?
And what has happened is you can actually stall or almost hold in suspended animation the aging process. And that's what we're finding. So I called this actually the continuum of beauty because we're, you know, again, it's not about overdoing things, because I'm not into that. But it's more of just doing things very, very slow, very strategic.
Yeah, just pumping the brakes just a wee
little
bit on
we
the
don't want a
aging
jerky
process.
ride.
Right. That's right. Well, thank you, Dr. Few. It's always a pleasure to have you here.